This is TTT Live. I'm DK Rostar. The Ministry of Health is giving an update on the status of COVID-19 in Trinidad and Tobago. We're bringing you live coverage on TTT, Choke City 91.1 FM, and on Facebook at TTT Live Online. We go now to Al Alexander, Senior Corporate Communications Officer at the Ministry of Health.
Good morning, and thank you for joining the Ministry. Good morning, and thank you for joining the Ministry of Health's virtual media conference for Wednesday, 2nd June 2021. At these media conferences, we provide an opportunity for you, the public, to hear directly from the subject matter experts and medical practitioners on the front line of the national COVID-19 response. We want to assure you that the Ministry of Health remains committed to providing you with relevant, accurate, and up-to-date information on the national COVID-19 response. Our panelists today are Dr. Roshan Parasram, Chief Medical Officer, Professor Michelle Montai, Professor of Immunology at the Faculty of Medical Sciences, and Nurse Penny Ramlagan, Senior District Health Visitor. I am Al Alexander, Senior Corporate Communications Officer at the Ministry of Health, and your moderator for this morning's program. We begin with the CMO, who will present today's clinical update. CMO.
Hi, good morning. Good morning to Professor Montai, Ms. Ramlagan. We'll begin with the clinical update for 1st of June 2021. If I could have the first slide, please. So, in terms of our testing so far at the public and private facilities, we have conducted 182,618 tests. The number of new positives reported over the last 24 hours are 405, taking our total since the 12th of March 2020 to now 24,314 persons confirmed as COVID positive. Total number of recovered patients stand at 14,249, with a total active caseload at 9,558 and 507 deaths. The total patients in hospital are 458, those in step down 180, and those persons in state quarantine facilities at this time 125. By way of immunization, we, as of yesterday, 4 p.m., we would have stood at 98,559 persons receiving their first dose with either the Sinopharm vaccine or the AstraZeneca, and total persons fully vaccinated 1,179. If we go to the number of persons in hospital, 458, as I said, broken down at various facilities. At the Kuva Hospital and Multi-Training Facility, 133 persons, 6 of those in ICU, 60 in HDU. At the Cora Hospital, 61 persons, Augustus Long, 48, St. Anne's Hospital, 36, Arima General Hospital, 69, New Point Fortin Hospital, 79, Scarborough Regional Hospital at the Fort, 30, and Scarborough General Hospital, Signal Hill, 2. So that brings me to the end of my clinical update, Al. Thanks very much for the time.
And thank you, CMO. I now hand you over to Professor Michelle Montai, who will present information on the safety and efficacy of the Sinopharm vaccine. Professor Montai.
Good morning, Dr. Parasram and clinical colleagues here in the studio, and a very good morning to everyone who has tuned in to this morning's briefing session. I have been asked to provide background on the Sinopharm COVID-19 vaccine, which is currently being used to vaccinate the population in Trinidad and Tobago. Can I have my first slide, please? Thank you. Can we move on to the second? Thank you. The Sinopharm vaccine is an inactivated virus vaccine. This means that it consists of killed SARS-CoV-2 viruses, which are then injected into your body. These cannot multiply and are not able to infect your cells, but they are able to trigger your immune system so that you can make SARS-CoV-2 specific antibodies and other types of immune cells. These immune cells and antibodies are then available to fight against COVID-19 infection should you come into contact with live virus from someone who has transmitted that to you because they are actively infected. The Sinopharm vaccine is produced by the Beijing Institute of Biological Products, which has a long tradition of producing vaccines for the Chinese population and is part of the government-owned China National Biotech Group. The Sinopharm vaccine received World Health Organization emergency use approval in early May of this year and is approved for use in Trinidad and Tobago and 44 other countries. Next slide, please. So far, the general public here in Trinidad and Tobago is well aware of different types of COVID-19 vaccines, such as the Pfizer, Moderna messenger RNA vaccines, the AstraZeneca viral vector vaccine, and now the Sinopharm inactivated virus vaccines. All of these have received WHO emergency use approval because they all stimulate good levels of immune protection against COVID-19 infection. So what do we know about this type of vaccine, inactivated virus vaccines? This is a very well-known and trusted technology that has been around since the 1950s. We use many different inactivated virus vaccines, including inactivated polio, hepatitis A, rabies, and some types of flu vaccines. They have an excellent safety record and can be used safely in persons with weakened immune responses because they are composed of killed virus which cannot infect cells or multiply in your body. Usually, these vaccines have to be given a few times to generate durable protection. For example, infants receive inactivated polio vaccine at 2, 4, and 6 months, and again when they enter schools between the ages of 4 and 6 years. Next slide, please. So let's begin to look at the efficacy of the Sinopharm vaccine. As you will remember, vaccine efficacy is determined in large phase 3 clinical trials, where large numbers of participants are either given vaccine or a placebo, and they're called the control group. And the assignment into either the vaccinated group or the control group is random so that bias is removed. These groups, the vaccinated and the control group, are then monitored over a pre-specified observation time to see how many cases of COVID-19 infection develops in each of these groups. As you can see, there were almost 13,000 participants in both the vaccinated group and the control group in this phase 3 trial. The study was conducted in the Middle East, primarily in the United Arab Emirates, and particularly in Abu Dhabi and in Bahrain. And now there looks as though there's a predominance of male participants in the trials, and this in fact reflects what is the demographic situation in this part of the world. Most of the participants were from Abu Dhabi, and in that population, 72% of the population are male. During the period of observation, which started on the 15th day after the second dose, there were 21 cases of COVID-19 that occurred in the vaccinated group and 95 that occurred in the control group, giving a vaccine efficacy of 78.1%. So what does this mean? This means that persons who are fully immunized with the Sinopharm vaccine, and by fully immunized, I mean that you have got both doses and you have waited 14 days. If you are fully immunized with this vaccine, it means that your chances of getting symptomatic COVID-19 infection is reduced by 78.1%. Next slide, please. So what were some of the side effects that were seen following vaccination with the Sinopharm vaccine? And these two graphs, these two charts, give the frequency of these different side effects. The grading, grade 1, 2, and 3, speak to the severity of each side effect. Grade 1 and 2 are considered mild adverse effects, while grade 3 is considered more severe. And as you can see, most of the side effects were mild and compared very favorably with the control group. Local reactions at the site of injection were seen in about 20% of vaccinees, with pain being the commonest manifestation. And about a third of vaccinees had some degree of systemic reaction, notably flu-like symptoms like a bit of a headache, fatigue, muscle ache, but a few had other things such as diarrhea. Next slide, please. But really, the acid test, so to speak, is how a vaccine performs in the real world, what we call real-world effectiveness. In this regard, there's been a lot in the media about how effective the Sinopharm vaccine has been in the Seychelles, where the Sinopharm and the AstraZeneca vaccines were used to vaccinate 86% of a target population. That was what they had achieved. And of that 86% of their target population that had been vaccinated, 60% of that was received. 60% of those received the Sinopharm, and 40% received the AstraZeneca. So there's been a lot about that and the fact that there's been a wave despite the amount of vaccination has been done there. So I decided that really I needed to go to the host to see what is happening in the Seychelles itself. So I went to their Ministry of Health. And what you see here is actually part of the Ministry of Health of Seychelles briefing on May the 24th, 2021. And what it tells us, I don't think you'll be able to read it, but it says most cases were asymptomatic or mild. Over 80% of admissions at treatment facilities had not been vaccinated. Almost all critical and severe cases that required ICU had not been vaccinated. And to date, none of the people who died had been fully vaccinated. So this suggests to me that the Sinopharm vaccine actually performed very well. We still don't know what is the variant that is circulating in the Seychelles. I am aware that there was work done earlier this year where they identified the South African variant, and some people have postulated possibly the Indian variant has entered that as well. We do know that the South African and Indian variants are a little bit more difficult, and that the South African variant has actually a vaccine efficacy against that particular variant is reduced no matter what COVID-19 vaccine has been used. Next slide, please. So in conclusion, I would like to say to you that the Sinopharm, like other inactivated virus vaccines, is safe. In fact, I would say very safe. Is effective in the real-world situation. And currently, the WHO recommends 2 doses, given 3 to 4 weeks apart. Thank you for your attention, and I look forward to many questions at the end. Thank you.
I'm sure you will be receiving many questions. Thank you very much, Professor Montai. We welcome back Nurse Penny Ramlagan to the conference. She will provide her personal experience on receiving the vaccine and will be encouraging others to get vaccinated. Nurse Ramlagan.
Thank you, Mr. Alexander. Good morning, Dr. Parasram, Dr. Montail, members of the media, members of the viewing and listening public. My name is Penny Ramlagan, and currently I work at Eastern Regional Health Authority as a senior district health visitor. A few months ago, I was afforded the opportunity to discuss the importance of vaccination and the importance of making an informed decision when it relates to vaccination. Today, I am here to continue that discussion and reiterate some key facts on vaccination. Let me start off by stating that vaccinations are safe, effective, free in Trinidad and Tobago, and it saves lives. The World Health Organization, WHO, Pan American Health Organization, PAHO, Center of Disease Control and Prevention, American Academy of Pediatrics, all reputable health organizations, all recommend vaccination. Vaccination has always been our first line of defense in protecting populations against vaccine-preventable diseases. It is the single most cost-efficient method as outlined by WHO. We know from the history of vaccination in Trinidad and Tobago that we have utilized vaccines for many decades, for as early as the 1970s, for example, with the introduction of the polio vaccine. Vaccination has been a safe way of protecting our loved ones from vaccine-preventable diseases. We even routinely administer vaccines like adult tetanus and influenza during pregnancy as recommended by the experts and listed in our SOPC guidelines, so the unborn baby can also receive protection from his or her mother. Even throughout this COVID-19 pandemic, Trinidad has continued to maintain an over 90% vaccination status in our under 1 population. This alone tells us the confidence we have in vaccination. Vaccine safety has always been a priority for WHO and other key organizations, and because of this, vaccines undergo a series of steps to ensure safety and efficacy standards are maintained before issuing vaccines to the public. And this same regulatory standards we have been trusting for decades is the same that exists today. I have been in nursing for more than a decade and have never had the need to fill out an ESAVI form because these regulatory standards ensure that vaccines that we use are indeed safe. The COVID-19 vaccine is the world's major line of defense in the fight against the COVID-19 pandemic. Together with adherence to the health protocols like wearing a mask, maintaining social distancing, washing and sanitizing of hands, together we can win this war against COVID-19. On April 6, 2021, I had my first dose of AstraZeneca vaccine at the Toko vaccine site. The first night following vaccination, I experienced mild body pains, fever, and headache, all of which subsided with Panadol, and I was without symptoms after that initial night. I took this vaccine because AstraZeneca, like the Sinopharm from China, was approved by WHO, World Health Organization, and by our regulatory standards, and because I wanted to protect my clients, colleagues, relatives, and myself. I also wanted to demonstrate pride in our ethical standards as healthcare providers. I adhere to the concept of non-maleficence, do no harm, and beneficence. Whatever we do must benefit our clients. I am anxiously awaiting my second dose of AstraZeneca for the second week in June. I am also actively involved in the vaccination process at the Toko vaccine site, not only as a supervisor, but as a vaccinator myself and an advocate for vaccination. The uptake has been very positive thus far, and this suggests a high vaccine acceptance in the population. I am proud of my colleagues who have led by example and got vaccinated. This has resulted in positive responses from our clients. To those who have not yet gotten vaccinated, I urge you to schedule an appointment at your nearest vaccine site and get vaccinated. Vaccination is safe, it is effective, it saves lives. It's time for us to level up in this fight against COVID-19, and vaccination is a key intervention coupled with adherence to the health protocols. Together they can bring us one step closer to ending this pandemic. It takes a team effort. Every one of us has a part to play. Stay home, stay safe, stay healthy, get vaccinated. Thank you.
And thank you, Nurse Ramlagan, for your testimony and encouragement. We now go back to the CMO for the epidemiological update.
Thanks, sir. So if I can have the first slide. What I'll be breaking down is the total persons in home isolation, using a few slides to go through. So the first one is up, I believe. Yeah, so this gives you a breakdown of where the cases are in the community. And over the last few months, we would have been providing this similar update showing the breakdown by county. So what we're seeing differently as opposed to 2 months ago, where County Carney, County Victoria, and St. Patrick would have been the counties with the largest number of cases, we're seeing roughly a similar spread among a large number of counties. So Victoria, St. Patrick, County Carney, St. George West, St. George Central, and St. George East are hovering around the 13-14%. St. George Central actually accounts for the greatest number, and it's a very small geographic area, but it's very highly populated. So 19.5% is quite a large number in that particular jurisdiction. Next slide. So this shows our clinical case disposition, and again, recovery is 4%, transferred to facility 3.2%, and we're seeing symptomatic 47.7% versus asymptomatic people, so roughly half and half in terms of the total clinical disposition at this point in time. Next slide. So comorbidities, a shift in the comorbidities has been noted. So if you looked at previous graphs of this nature a couple months ago, and we would have seen diabetes and hypertension possibly accounting for the greatest portion of it. We see a dip in the number of persons with diabetes actually becoming positive, and we have to look towards the immunization strategy that we have in the country, where, of course, healthcare workers, those over 60 initially with comorbidities, are now over 60, plus those under 60 with comorbidities have been added. And a lot of the patients with diabetes have been getting their vaccines. And we have to keep a close eye on this statistic to see if it continues to drop. Is a good sign, because once you have diabetes together with COVID, you tend to have complications. So we're seeing that diabetes number going down, keeping a close eye on the number of asthmatic patients, which seem to be going up. And we have to, of course, get those persons to have their vaccines as we go forward. Next slide. So again, comorbidities in home isolation. Those with comorbidities accounting for 39.4%, without 60.6%, which is a little bit of a flip again as to where we were a couple of months ago, and a good sign. Patient distribution, next slide. By age, again, we're breaking down 0 to 95%, 20 to 39, 29.49%, 40 to 59, 32.94%. Roughly what has been happening throughout the epidemic is those in the 20 to 60 age group has accounted for the greatest number of infections. Those in the 60 to 79, 16.31, and 80 plus 16.18. Next slide. So just a contrasting male and female. For the entire duration of the epidemic in Trinidad, we have seen more or less 50-50. So at some points the females are a little bit more than the males, and here in this case the males are a little bit more, 52.4 versus 47.6%. So if just one other bit of information, as I would have alluded to at the Prime Minister's press conference on Saturday, we were looking towards a policy shift in regard to those who had COVID and have to receive vaccination. So we would have met with the TAG group, of which Professor Montai is a part, yesterday, and confirmed that those who have been infected with COVID need to have vaccines. And now our national policy is to have it 3 months after infection and not the 6 months as it was before. So there's a shift. So if you had your first dose, you get infected, you wait 3 months post-infection. If you have no doses, you get infected, you wait 3 months post-infection as well. So Al, that's my clinical update for this morning.
Thank you very much, CMO. We now move into our question and answer segment. Media representatives, please begin by stating your name and the name of your media house before directing your questions to our panelists. Our presenters will respond to 2 questions per media representative in the first instance. As you know, if time permits, we will accommodate an additional question from each media house. We begin with Newsday.
Hi, good morning. Paula Lindo here from the Newsday. My questions this morning are for the CMO. I saw that the health minister had approved 3 vaccines in legal notice number 174, among which was the Pfizer vaccine on May 21st. And I wanted to know if that is in anticipation of us receiving vaccines from Pfizer in the near future. And then also this morning on one of the morning programs, the head of one of the chambers of commerce is claiming that he knows Pfizer vaccines were imported and used to vaccinate the staff of a medical facility. Could you tell us anything about that? Thank you.
Okay, so yes, the Pfizer vaccine was gazetted in our local newspaper together with the Sinopharm vaccine as well as the AstraZeneca vaccines. What we have done is we have tried the Johnson & Johnson vaccine as well as the Moderna vaccine will be going before the Drug Advisory Committee shortly as well. We are trying to keep abreast of what is happening by WHO standards in terms of their approval, and we are considering the vaccines even before they are scheduled to come into the country. So what we are doing is preemptively approving all the WHO approved vaccines, looking at the dossiers, making sure everything is okay with it. In the event that negotiations go forward quickly, we have already crossed that hurdle in terms of negotiation. So with Pfizer and AstraZeneca and Sinopharm, we have already gone ahead and approved, and we are going towards Moderna and possibly Johnson & Johnson in the near future. With regards to the statement this morning with respect to Pfizer being in the country, it hasn't been imported through government legal channels. I have confirmed with the head of the Food and Drug Division this morning that no request has been made to his department for importation and no approval therefore has been given. So if someone has brought in Pfizer, it will be through illegal channels. If any information is known, you can share that information offline to myself or the Food and Drug Department, and we will look into it further.
Thank you very much, CMO. We now move to IETV.
Hi, good morning. Vinima here from IETV News. I have two questions. Hopefully can be addressed by the CMO. My first question is, recent media reports have indicated that the Indian variant has been detected in Venezuela. Worst case scenario, and TNT by somehow, maybe through illegal entry perhaps, unfortunately, we get this virus in TNT. Is the Ministry of Health prepared to deal with this outbreak, seeing that the virus is more transmissible and a bit more dangerous than the Brazilian variant? And my second question pertains to the ambulance situation. Of course, again, via media reports, we would have known about a situation where a mother had to give birth at the side of the road in her vehicle because of a lack of ambulance services. So can we have an update on the staffing and availability of ambulances? Thank you.
Okay, so first question relating to your variant. As of yesterday, the WHO has put out alerts, so they actually confirm which variants are in which part of the world. As of yesterday, they confirmed that the only variant in Venezuela was the P1 variant, which is the Brazilian variant. However, just to go into your question, I think any variant, and I said it before, any variant that comes into a country, the public health measures that we utilize to fight them are more or less the same, which is, of course, wearing your mask, social distancing, and all the others. Avoiding congregation, and of course getting vaccinated as quickly as we can. It's a fairly new variant in terms of the variants of concern, and again, in terms of the efficacy of different vaccines, the data is not complete as to say which one will protect in a greatest way against the Indian variant in particular. But again, the same public health measures apply, and we ask that everyone come forward, have your vaccines as quickly as you can once they are available. We try to protect our population in that regard. With regards to the births in San Fernando, I've been in contact with the CEO of the Southwest Regional Health Authority, and he has indicated to me it was the GMRTT ambulance, which is a separate service, was en route whilst the event occurred. The baby and the mother, from what he has indicated, is fine. But I can't speak to the capacity of GMRTT directly at this point in time.
Thank you very much, CMO. We now move to AZP News.
Hi, good morning. Priya Bihari, AZPnews.com. My first question has to do with the Sinopharm vaccine. So I don't know if the CMO or Professor Montai can take it. Since the WHO has approved the Sinopharm vaccine, they have also approved it for women who are pregnant or lactating. And they have also approved it for people over 60 years. But the clinical trials has not been, there has not been enough clinical trials in terms of how effective it is with people over 60. But Trinidad and Tobago, we are using the Sinopharm vaccines for people over 60, but we are not using it for pregnant and lactating women. So I just want to know what is the reason behind these two issues in which in one, aminonutrients in another group. And my second question has to do with the AstraZeneca vaccine. CMO, we have started, well, we will start to give the second jab on June 6th, and the first jabs started on April 6th. Now, the WHO has said that the second jab must be given between 8 to 12 weeks, but the closest to 12 weeks is the most effective. And we do have a lot of AstraZeneca vaccines that would expire on August 31st. So I'm asking, why don't we just give people the second jab closest to the 12th week as possible, rather than starting on the 8th week? Thank you.
All right, I'll take the first question. Okay, you are very correct in that the number of people 60 years and over in the phase 3 trials was relatively small. Let's say on average it was about 200. But prior to that, what they did was that they did phase 1 and phase 2 trials. And what they also did, so where they had now as well people who were older, and they actually looked at the neutralization antibody levels that were developed in these people who were 60 and compared them with the younger, 60 years and over. So that what they said was, okay, we agreed that the numbers so far, I just want to say what they have published is an interim analysis. They still have data that they're collecting. That in the 60 years and over, but we can say from the kind of immune response that we are seeing from the neutralizing antibodies titers that they're getting, that people over 60 will be protected as well. A very similar thing happened with AstraZeneca. We don't have to go back far. When Europe had put up its shackles, we will not use AstraZeneca in the over 55s, right? Remember? Because they too complained that the numbers of over 60s in those trials were also small. But then we went into the real world situation. You went to Scotland, and the Brits said, you know what? We're going to start immunizing the older people first. And they started to immunize several million older people in Scotland with AstraZeneca and with Pfizer. And you know what? AstraZeneca performed better. So that at the end of the day, to some extent, you're right. Phase 3 clinical trials give you information. But they're not, at the end of the day, the be-all and end-all. At the end of the day, we have to go with the accumulative evidence from all phases of trials and then the real-world experience. With regards to the pregnancy and lactating, maybe I'll ask the CMO to do that one.
Yeah, so generally, yes, WHO has approved Sinopharm for both pregnant and lactating mothers in their initial go. The Ministry of Health remains cautious, so I had asked the Director of Women's Health, who actually met with the TAG group yesterday, provided some initial data, and he's coming back to us, he said, by the end of the week with a position paper as to basically why we should move from the status quo and go towards vaccination of the pregnant and the lactating mothers. We will consider it at the TAG group at that point in time once we have the data from him. It is a matter of benefit versus risk, and again we have to consider the fact that some of these vaccines have not been used for such a long period of time that for the pregnant mother in particular we have to be cautious of the impact on the developing fetus. So we have to be very cautious. We will wait for the data from the Director of Women's Health, and we will consider it when he provides it to the TAG group. With regards to your question related to AZ vaccine, so I think you're right in what you're saying. The recommendation initially is 8 to 12 weeks from WHO, remembering that the manufacturer had originally said 4 weeks. We have to bear everything in mind when we make national decisions. And what we look at is the epidemiological status of the country at this point in time, the amount of persons being infected, and we took a decision to have that rather than go closer to the 12 weeks, which will give you a slightly better effect, at least on paper. What we will do by bringing those persons down to 8 weeks is that we will be able to get a month ahead of schedule a much larger group of people with 2 vaccines, which will benefit the country. I think the benefits far outweigh waiting that additional month at this point in time. So again, the policy is taken in lieu of the epidemiological situation in the country.
Thank you for your questions, Prior. We now go to Guardian Media.
Hi, morning, everyone. Rashad Khan, Guardian Media Limited. Okay, so I just want to piggyback off of one of the questions which would have been asked by my colleagues prior. With respects to the Pfizer vaccine being rumored to have come into the country on the down low and been administered, you asked our people if they have any information to come forth to the ministry. But I'm just wondering, what are the repercussions of something like that happening? What are the legal consequences of that? And my second question, CMO, I don't know if you'll be able to answer this, but I believe over the past few days, there would have been reports in the regional media that about 1.5 million doses of Johnson & Johnson vaccines have been allocated to CARICOM. And I'm just wondering, is Trinidad going to be getting a piece of this allocation? How much, and any logistics involved in that, like when we're expecting it? Thank you.
Yeah, so in terms of your legal consequences, I think it's an importation issue. It may be a breach of certain aspects of the Food and Drug Act, but I don't want to pronounce on it. It really is a matter for the Attorney General and the Ministry of Legal Affairs. Once the ministry picks up a breach, we send it to them, and that part of it will be determined by that ministry. In terms of the quantities, again, I will leave that discussion to the Honourable Minister, hopefully on Saturday, to go into a little more detail as to which vaccines have been allocated to the country in what quantities, and so he will go into a little more detail when he comes on Saturday.
Thank you very much. We now go to CL Communications. We're ready for your questions.
Hi, good morning. Natalie Singh, Caribbean Lifestyle Communications. Can you just go through the logistics when it comes to a patient having to transfer from one hospital to the next? What happens when the oxygen runs out en route to the other hospital? So that's my first question. My second question is, on Saturday, CMO would have spoken about a patient who would have had complications after taking the AstraZeneca vaccine. I was just wondering, can you give an update on this person, and did the person have comorbidities? Thank you.
So yeah, so I'm not sure about the first question that you're asking about a particular instance that occurred in the system, but I mean, generally speaking, when a patient is transferred via ambulance, the ambulance is outfitted up to national standard. There's a process through the Transport Commissioner as well as through my office where both the ambulance and the equipment on board are certified. There's a body that actually also certifies the technicians on board, of course, nurses and physicians if need be. So I'm not sure if an incident has occurred that you raised the question. But generally speaking, they have all the equipment, they have oxygen in supply once the patient is to be transferred. The other patient continues to be at home. I don't want to go into details about that particular individual, but again, continues to be at home and monitored by the specialists and receive the care as per the clinical guidelines for the country.
Thank you very much, CMO. We'll now take questions from TV6. TV6, good morning.
Hi, good morning to the panel. Are you hearing me?
Loud and clear. Please
Hi, good morning.
Your question.
All right, so my first question is to the CMO, and I want to just follow up from Nadline's question. In terms of both hospitals at Point Fortin being converted to COVID-19 facilities and not having a 24-hour emergency, given that family the only other option of trying to rush to San Fernando, what can be done to mitigate against persons who actually have serious emergency situations within that Point Fortin region that they need to attend to? So that's my first question to the CMO. Second question is to Dr. Montai. Dr. Montai, I know that in certain parts of China, they've been experimenting with giving 3 doses of the Sinopharm vaccine to boost efficacy. What is your take on this, and should we be considering that at this time?
You want to go first?
Okay, thank you so much for your question. Effectively, right now we're hearing about boosting for almost all the COVID vaccines that are available. I'm not surprised that they, in fact, are using a booster. They, in fact, is being used in Bahrain right now. They are currently giving, and in the UAE, Abu Dhabi, they have been given a third dose, 6 months after the second. Yeah, that's what's happening. I don't know specifically the formulation of that, but that certainly is happening. So I don't think that we can rule out boosters. As I said, inactivated virus vaccines, very often you might have to boost to maintain that durable protection. And so, yes, I think that we are hearing of boosters for Pfizer, Moderna, AstraZeneca, and I think it is on the cards, and it is happening for Sinopharm as well. I don't have anything else to add.
Yeah, so in terms of your first question, I had spoken to the CEO of the Southwest Regional Health Authority this morning. He has indicated that a press release had gone out. What they're doing is they're boosting the capacity at the Point Fortin Health Center. So that is currently working 8 to 8. And from tomorrow, I believe he indicated that that facility will be doing a 24-hour service to replace the services that would have gone down prior. In addition, early next week, they will make some announcements as to some additional boosting of the capacity in that particular area based on the realignment of services at the Point Fortin old and new hospitals.
Thank you very much, CMO, and of course TV6 for those questions. We move across to Radio Tamron. We're ready for your questions.
Yes, good morning. Are you hearing me?
Loud and clear, please ask your questions. Thank you.
Yes, hello, good morning. Yes, good morning, Clayton Clark, Radio Tamron. My questions are, May 31st was World International No Tobacco Day. Has there been any links to tobacco use and coronavirus infections? Has the coronavirus impacted, or what has been the impact of coronavirus on smoking? And my second question, what is the extent of the monitoring of patients who have recovered from COVID-19?
Okay, so generally speaking, long-term tobacco use and smoking in general will cause chronic lung conditions in some persons, right? They will cause chronic obstructive pulmonary disease, they will cause cancers, and those conditions are associated with a higher degree of morbidity and mortality as it relates to COVID-19. So a greater amount of severe illnesses, a greater amount of deaths in those particular individuals, because it is primarily a disease that affects the respiratory system. Smoking also causes a change in the way our clotting system works. So in that regard, COVID as well causes clotting thrombotic events. So both of them together will probably exacerbate the effects of each other. With regards to your monitoring, as you know, North Central Regional Health Authority in particular, being the hub in the beginning for COVID-19, created a COVID clinic for long COVID patients, or patients having symptoms persisting beyond the normal 1 or 2 weeks after infection. So we continue to monitor those clients through that network, and of course, at the persons that are at home, we continue to monitor them at least until their quarantine period is over, so that they can't transmit from one person to the next. So I hope that answers your question to some extent.
And thank you very much, TMO. We move across to I-95.5.
Good morning to everyone. Whitfield Turner from I-95.5. Dr. Montai, if you can address this issue for me, please. A lot of persons have still been asking as it pertains to the vaccines. We've been able to get a vaccine for COVID-19 within a relatively short space of time, but even after several decades, we don't have a vaccine for HIV, we don't have a vaccine for any form of cancers. Can you say exactly why it is that we haven't had vaccines for those illnesses thus far? And for the CMO, if you can address what are the risks involved re-interacting with the dead bodies on the Mauritania boat, and what's the likelihood of them being infectious even after the period of time that they would have been out at sea?
Sure. Well, first of all, I have to correct you. Those who have asked you some questions. We actually do have vaccines for cancer. HPV vaccine prevents cervical cancer, prevents some types of anal cancer, prevents some kinds of oropharyngeal cancer. So, yes, so that's a vaccine that is preventative. And people who are HPV are actually good protection against the development of cervical cancer, which has been a killer among females in this part of the world. So that's one thing. The same messenger RNA vaccines that Pfizer and Moderna use, that technology has actually been applied to prostate cancer. So that there are vaccines of that type in the treatment of prostate cancer. So that too is not really quite accurate. So that we have, so the technology has been around. I think that what I think is not being fully understood is that it's like building a car. If you could build a car, you could change around the inside, you could change around the outside, etc. But you could still build the car. And platforms like the messenger RNA vaccines, like the viral vector vaccines, have been used for a while. For the viral vector like AstraZeneca, there's a commercially available Ebola vaccine, which Johnson & Janssen, who partnered with Johnson & Johnson, has made. It's widely used, right? So that technology, you now apply it to coronavirus. So the messenger RNA against the prostate cancer, you now apply it in the situation, but you know how to do it. And as I was saying, the inactivated virus that is Sinopharm, that technology has been around since the 1950s. So we just apply it to the coronavirus. And so I don't think it's accurate that it's just developed quickly. It is that we are using technologies that are being used in all those areas that you were speaking about.
Okay, yeah, so your second question related to the interacting with the bodies that came ashore in Tobago. So generally speaking, there's a lot of unknowns as it relates to those persons. Initially, you found bodies in a boat, and then of course we would have taken all precautions and recommended to Tobago that all precautions be taken in the event those persons would have been infectious for one pathogen or another. There was, as I said, a lot of unknowns. We didn't know where they came from in the first instance. In hindsight, we were able to find out more information as the possible point of origin, but we would have continuously treated those persons as being infectious for one disease or another. So precautions were taken from the point of view of the handler, and of course from the forensic pathologist who was doing the autopsies on those individuals. We asked that they perform their autopsies using a very high containment level, biological containment level 3 or 4, related to the degree of pathogen, as being unknown, and take all precautions to prevent the spread of that disease. So hopefully our precautionary measures would preclude any infection, but the risk, if it is that those persons would have come all the way from Africa, the coast of Africa, on board the vessel, traversed for that length of time, we assume, we don't know the time of death, we assume that the possible infectivity of those individuals would have been low by the time they got to this part of the world.
Thank you very much, CMO. We will now move to additional questions. On Newsday, you're ready for your additional question.
Hi, good day. So I have more than one, but my first one is the SWRHA has issued a flyer with dates for the AstraZeneca vaccine rollout. Will the other RHAs be doing something similar? The flyer has, if you are vaccinated on April 7th, you come out on June 6th, and it goes down in chronological order.
So generally speaking, I think Southwest Regional Health Authority is using one particular venue for their vaccination program. We saw that, as you said, they sent out dates so that correspond. That was one way they can deal with it. Some of the other RHAs have been calling their clients. We have a complete list of who got their first vaccine. Some of them have been calling persons to actually let them know when they can come and where they can come. So it's being done in those two ways. It's variable amongst the RHAs at this point.
Thank you for your question. CNC3, your follow-up question, please.
Hi, good morning. Okay, so my follow-up question is a bit similar to what Ms. Linda would have asked. I know some people, myself included, when we got our first dose of the AstraZeneca, we were given a date to return for the second dose. But now within the SWRHA, they have some new dates. So how does that dynamic work? Do we go with the new dates that were given out? Do we wait for a call? Or do those persons go on the date that they would have initially been given?
Yeah, sure. So with regards to Southwest, you go on the new dates that would have been published. And of course, the new dates that when persons would be called, they will be given a new date and a new location as well to have your vaccination. So we go with the new dates. What has happened, as prior indicated, is that there was a shift. So our initial time would have been closer to the 12-week time, some between 10 and 12 weeks. So we're trying to bring that forward as quickly as we can towards 8 weeks to get a larger number of people vaccinated. So you go with the new dates that are given to you. And just to be assured, regardless of the type of communication that the RHAs are using, all of those people who would have had their first dose will be contacted either way, and they will get their second dose with the AstraZeneca vaccine.
Thank you, CMO. We now move to AZP News for your follow-up question.
Hi, good morning again. I just wanted to find out from the CMO in terms of the new cases and the figures now. Do you think that that we're now plateauing? Are we seeing a decrease in the numbers? Should we expect for us to get out of the situation soon? Thank you.
So what we're seeing is yes, some smaller numbers in the daily reported figures. We have a broken week in terms of holidays, and a lot of times some of the laboratories are down. For example, the Caribbean Public Health Agency would be down on a weekend, on a Sunday and a public holiday. So some of the figures would be a little askew this week. I think we wait until next week. Don't let the figures be a real guide. What we are using, as you know, is the epidemiological curve, which actually looks at swab date. So the date of swab gives you a better indication, and we have begun to see a slowing, as Dr. Hines would have indicated on the Saturday. And hopefully, the first larger of the grouping of measures, which is essential services, coming down on the 8th of May. Normally, measures take 14 to 21 days to begin to take effect. And of course, the SOE would have happened 1 week prior to after that. So we are roughly just about 2 weeks into the SOE, and we expect to see the impact of those events happening all about now in terms of the numbers coming down. And we hope that the 200 plus and then 400 yesterday is an indication that we are beginning to see a slowing. But we have to be cautious that if we have large outbreaks occurring from time to time, you can have, as you saw with the police service and other services, you can have 200 people infected in a short period of time, which actually creates a lot of contacts and can get that number back up very quickly. So we all have to keep following our public health guidelines, stay away from the congregations, wearing our masks, most importantly, anytime we leave or go into a public space, and of course staying away from work or any other place when you're ill goes a long way to prevent the spread of the disease. And lastly, of course, get your vaccine when it is offered to you.
Thank you very much, CMO. TV6, we are ready for your follow-up question. Oh, we're not hearing. Could you unmute your mic? Alicia?
We know that in terms of the Sinopharm vaccine, it's not, in terms of efficacy, not as high as, let's say, Pfizer, that is at 95%. Sinopharm, I believe, is at 78%. And the question has been asked in terms of our goal in achieving herd immunity, whether vaccine efficacy is linked to that, and if so, how does taking a vaccine with a lower efficacy impact upon us achieving herd immunity? Is it that we'll have to vaccinate a higher percent, higher than 70% of the population?
I think we have to be careful about efficacy. Efficacy is more complex. A lot depends on where the context in which that phase 3 trial took place. The phase 3 trials with Moderna and with Pfizer took place almost exclusively in America with a certain strain occurring. They didn't have this multiplication. Take J&J. J&J, AstraZeneca, they were doing clinical trials in South Africa. If Moderna and Pfizer had done clinical trials in South Africa, we might not have been seeing 95 and 94%. You see what I'm getting at? So efficacy also has to be interpreted in relation to where that context is and what's circulating. So I just want to put that there. It's useful, but it's not the only thing. So at the end of the day, we still have to see real world effectiveness. And that's why I come back to the Scottish story, because it really was impactful. If we took AstraZeneca and we looked at the data, we had anything from 60 to 90%, and everybody put up their hands. But when the UK took it and started to immunize its people, and particularly in Scotland, AstraZeneca performed equal to or even better than Pfizer. So I'm getting that is that the efficacy is what people are holding on to, and yes, the media has played it up to whatever, but it's more complex than a number, and you have to see the whole picture. And I think that what we are lucky at here now is that we're pulling up a lot of real world effectiveness, and I want us to hold on to that. And that's what I think is very important. So I hear you. I agree with you. And someone told me the other day, well, she's waiting for the Pfizer. I thought, well, maybe next year sometime. But the point is just in my mind, that may not be true. But the point I'm getting at is that the best vaccine you can take is the one you can get now. And that's going to give you some protection. And what we are seeing even in the Seychelles is, despite all the media reports, the Seychelles themselves have said that it's preventing severe disease and it's preventing death. And I think those are two things that anybody would want to prevent. So take your vaccine when you're called up. Thank you.
Excellent advice, Professor. Thank you very much. We now go to CL Communications. Please unmute your mic. Please unmute.
Are you hearing me?
We're hearing you.
Okay. I was just wondering, when it comes to police and healthcare workers, what type of vaccines have they received? Is it the AstraZeneca? That's all I want. Thanks.
Well, I mean, different persons have received different vaccines. So we have, in the first instance, when we had the very high risk receiving, all we had at the time was the SII, which was AstraZeneca. We had offered the healthcare workers AstraZeneca at one point in time. Some of the police officers have taken AstraZeneca. Some of them have gotten Sinopharm outside of the process that we have used. For example, someone calls up and makes an appointment. They could have gotten Sinopharm as well. So they got different vaccines at different points in time. So both Sinopharm and AstraZeneca.
Thank you very much, CMO. I will take our last question from the Newsday.
Hi, good day. My final question is, what is the impact of Sahara dust concentration on COVID patients at home, and what can they do to mitigate this?
Okay, so COVID patients at home, I mean, generally speaking, when you have a viral illness, environmental conditions will affect you in any way. So if you are so prone to have that sort of reaction with Sahara dust, for example, you'll tend to have an exacerbation of the viral symptoms in most instances. Of course, staying indoors, which we expect that COVID positive patients will do, will go a long way, and we expect that you'll be wearing your mask as well. So if you continue to do those two things, I think the impact will be minimized. Stay indoors and wear your mask.
And we've come to the end of our question and answer segment. Thank you for joining us today for this media conference. We really do appreciate your presence at these conferences each week. We urge everyone to do his and her part to safeguard the health of our nation. Please practice the 3 W's. Wash your hands, watch your distance from others, and wear your mask. Goodbye for now.
I will make food security a reality.
I will design groundbreaking prototypes.
I will create the next life-saving vaccine.
Whatever your career aspirations, the University of the West Indies St. Augustine campus is where tomorrow